Hello, this is Dr. John Wallman. I'm here with another in the series of the reasons for calm regarding COVID-19. This episode is regarding vitamin A, reducing infection and mortality rates. All right, let's start with a very quick review of the immune system. This was one of the other short videos we had, and I don't want to go into detail on this, just to remind you. The immune system protects against viruses, and it includes not only the white blood cells and lymph nodes, it also includes antibodies, a number of chemicals that increase inflammation. Inflammation is part of the immune system response to viruses. The immune system is also composed of a number of tissues, including skin, mucous membranes, liver, bone marrow, the blood system, thymus, spleen, lymphatic system, and other tissues. And the key point to remember is, what does the immune system need to fight infections? The number one thing, by far, is it needs the essential nutrients. These are the vitamins, minerals, essential amino acids, and essential fatty acids, of which there are 42. And the 42 chemicals that are essential nutrients have gone through a rigorous scientific process, frequently taking decades, and has to go through this process until there's a consensus in the scientific community that this chemical must be ingested on a regular basis in order to ensure life, just to stay alive, to grow, to repair, and to remain fertile. In short, if you get low in any one of these, you start getting sick. And the lower you get, the sicker you get, until with many of them, you actually die. Okay, so regarding those 42 essential nutrients, if you get low in them, by definition, it results in either death or disease and a significant reduction in your resistance to infection and illness. So these are the key things, and everybody should be getting tested for these 42 essential nutrients on a regular basis, every year or more often if you have some issues you're dealing with, possibly less often if you're in very good health. Let's start with vitamin A. So, and before we get into the details on vitamin A and some of the research on vitamin A, it's important to note that if you're low in an essential nutrient like vitamin A, it'll give you benefit if you increase your intake. And by whatever method, whether it's by food, supplement, or whatever, the important point is, if you're low, you have to increase it. If you're not low in an essential nutrient, supplementation or changing your diet to increase levels will either not help at all or can even make the situation worse. And that has confused some of the research regarding vitamin A in the past. So let's look at some of the basic research. And just a fundamental thing, vitamin A plays an essential role in many physiological processes, including immune function. And for all of these, I have the references for every bit of research and every quote that I bring up for the rest of this little video. So next quote, metabolic changes that occur during infections are complex, and vitamin A deficiency compounds the problem and may be crucial in exacerbating morbidity and mortality. Morbidity means you get sick, mortality means you die. Okay, so end quote on that one, and it's from Clinical Infectious Disease Journal. Next quote from a research project we have is regarding vitamin A supplementation and infectious diseases. We have, quote, analysis of these supplementation trials yielded a highly significant reduction in all-cause mortality by about 30% and by 23% in the second analysis. So, and those two references are given at the bottom, British Medical Journal and the Food Nutrition Journal. Going on, quote, no nutrition deficiency is as likely to be associated with infection as lack of vitamin A, end quote. Next quote, these results suggest that both vitamin A and another product may be important in maintaining immune function or limiting severity of infection in children older than 5 years of age, end quote. And we have also, quote, decrease in the severity of measles morbidity could explain an overall average reduction in measles-specific mortality by about 60%. Now, this is a very significant series of studies that were done. They looked at measles and people who died. One of the research projects had the World Health Organization giving out measles vaccine in a third world country. And they found that they did decrease the number of people with measles, but they didn't decrease the number of people who died. They did die shortly thereafter of something else, maybe the cold or some other minor issue, because their immune system was failing because of, as we'll see in a moment, vitamin A deficiency. And without sufficient vitamin A, your immune system does not work well. And so these people, they'd give them a vaccine, nothing happened. Then they went back around and they started giving out vaccines for measles and vitamin A, and they found out that the mortality rate dropped dramatically. So then you have to ask the question, is it the measles vaccine that is actually saving lives, or the improvement in diet, availability of food that increase the availability of vitamin A? And that's been a debate that's been going on for years. And unfortunately, it seems right now the people who are promoting the idea that the vaccine is what's saving lives are winning the battle, and vaccines are being forced on people, even though they're not decreasing mortality. Next quote. Serum vitamin A serum levels of vitamin A were significantly lower in recurrent respiratory tract infection group. So this was a correlation study. They looked at a large number of people and they measured their vitamin A levels and went back and said, okay, who's getting respiratory tract infections regularly? And they noted that the people who were low in A were highly correlated with people getting recurrent respiratory tract infections. And with COVID-19, that's specifically what we're interested in. Okay, so here we have an interesting study, and this one found that for children who have adequate vitamin A stores, so people who are already fine with their vitamin A levels, they found that supplementation, particularly with high doses of vitamin A, may actually cause a temporary malfunction in the regulation of immune function. In other words, they got more sick, more severe, worse outcomes. If your vitamin A levels were normal to begin with, and then you supplement with high doses, okay? Now, vitamin A in particular has particularly low toxic levels compared to the therapeutic levels. There's not much of a gap between them. So in this case, you do need to pay a lot more attention to what your starting levels are. You want to make sure that someone is deficient or subclinical deficiency before you start dosing with high levels. Now, lower levels are not as much of a problem, but we'll talk about that in a little more in a minute. So the next study found, quote, vitamin A supplementation is effective in reducing all-cause mortality by about 24% compared to no treatment at all. And this is regarding infections. And this was by the Cochrane Collaborative, which is an excellent group. They've been doing superb work for over 20 years, although there have been some changes in the organization just this past year that may make their work from now going forward less reliable. But previously, their work has been spectacular. One more quote on this page is, deficiency of sufficient duration or severity can lead to disorders that are common in vitamin A deficient populations, such as weakened host resistance to infection, which can increase the severity of infectious diseases and risk of death. That's kind of the bottom line that we're talking about here, is if your vitamin A levels get low, your resistance gets lowered, your chances of getting infected goes up, and your risk of dying go up. And this was a study done by the World Health Organization. All right, let's spend a slide or two going into the vitamin A deficiency terms, because this is what has gotten a lot of people confused in the past. You get some people referring to a vitamin A deficiency, and they're talking about a severe deficiency with pathological changes, and they're saying, this hardly happens. Yes, maybe so, but the mild deficiency stages happen quite often, And those are the ones that can lead to major changes in clinical outcomes. And it's that mismatch in communication that gets a lot of people confused. So what are we talking about here? In the mild stages of a vitamin A deficiency, you're going to have maybe some changes in blood or storage levels of the nutrient, but there'll be enough to make functional changes. Now, what do I mean by functional changes? Decreased rates of white blood cell production or decreased rates of antibody production. So, for example, somebody who has just a mild deficiency, their white blood cell production rate might go down 10%. But a 10% decrease in white blood cell production during the time of an infection can be pretty critical, much less a 30% decrease or 40 or 50% decrease rate of white blood cell production. Those are very, very substantial into what kind of output you're going to have, but the person might not have a vitamin A deficiency stage severe enough to cause, for example, blindness. So let's go into that a little bit more. So in the moderate stage of vitamin A deficiency, you can start getting a major disease state. And by that I mean tissues are going to start changing. Not just blood levels or storage levels, but your tissues start looking different if you look at them under a microscope. The lung membranes might be thinner. The mucous membranes might be thinner. You could be producing less mucus. As the mucus goes down and the thickness of the membranes go down, they become more porous to the viruses. The viruses can attach more easily to your lung tissue and cause a more severe infection. So you can get major disease states while you still only have a moderate vitamin A deficiency. And then going to the severe category of deficiency, this is when vitamin A levels, for example, are so low that now you've got major changes in tissues and organs. So blindness, for example, is a very common vitamin A deficiency state, and death from vitamin A being bad enough. So these certainly are pathological changes. They're really easy to detect. There's no question, yeah, you've got a deficiency. And the number of people that get to that point might be relatively low. But the outcomes of someone who's mildly deficient can be very severe outcome. So to summarize just this one concept here, the stages of deficiency refers to the direct nutrient deficiency diseases, not necessarily to the severity of the outcome. So again, you can have a mild vitamin A deficiency that gives you a very, very severe outcome of death from infection because your white blood cell production rate was too low. So just to recap the deficiency terms, you can have dozens of different terms that refer to deficiency states. Some of the frequently used ones are deficient. And most commonly, that's used in the context of the severe deficiency. You also have the term insufficiency, which is something a little less or sometimes used interchangeably with deficient. But it frequently is used a little more commonly in the context of a moderate deficiency. And then you have the subclinical deficiency. And to a lot of people, that sounds like, okay, not so important. It's subclinical. It's below the level of a clinical problem, but that's not what's being referred to. They're referring to a subclinical vitamin A deficiency state, not necessarily that your situation is subclinical. So it means you can't do a test that determines if there's a pathological problem, but your functioning is reduced and your outcomes could be substantially reduced. Okay, so let's look at a couple of numbers. One study found that 17.7% of women were insufficient in vitamin A and 33.6% of children were deficient in vitamin A, and this is in Benin. Another fairly big study done in the Middle East found overall in the ballpark of 10% overall deficiency of vitamin A. Okay, now if you look at these numbers of deficiency states and the prevalence of that, notice how these numbers are quite a bit lower than the improvement in outcomes from infections, how much reduction in mortality there was from infections. And it's that difference between the improvement in outcomes, the decrease in mortality rate, and this overall prevalence of deficiency states from vitamin A. It's that difference that is the subclinical deficiencies. So that's pretty substantial. On some diseases, we were talking as high as 60% reduction in mortality just by improving your vitamin A status. But if only 10% of the people are deficient in vitamin A, but you're saving 60% of the lives, that's a really substantial change. So you have to be very careful when you start looking at prevalence of vitamin A deficiency. That's not telling you the numbers you need to know. Okay, so in summary, bottom line is testing for and correcting vitamin A deficiency is the most important nutritional factor that will significantly reduce the number of people who get infected and will also substantially reduce the severity of illness and chances of dying from respiratory infections like COVID-19. Thank you very much.